The topic of compassion in public health can raise a lot of questions in people, which is how do you validate something that may not be completely measurable by scientific standards? And I think in medicine today, evidence-based medicine is a demigod, if you will. I'm a physician, I see patients, I very much respect science, but I also have a healthy recognition of the limitation of science. I think when we look at what is valuable for people, be it on an individual level or on a global health level, we need to look at something broader than purely science and purely the physical. So the question of what is measurable and what isn't, and should we only practice individually in medicine or have policies on a global level, those things that have been proved by scientific, clinically controlled trials, should that be the only standard that we use? I would say no. I think we have to be much broader in how we investigate and analyze what is good for people. So there's quantitative as well as qualitative data, and part of qualitative data is the narrative, the story. And we really are people creating stories. And global health is an amazing story of how people in different cultures come to understand their life, come to understand suffering in their life and what that means to them, come to understand health. What is health and well-being? That's a story, that's a person's story. One of my colleagues, Dr. Rita Sharon, says what she begins her interview with patients is, what do I need to know about you to be a doctor? And I would say that on a global health level, we need to know the stories of the people that we are serving. And whether we actually see the individual faces of every single person that may be affected by global health policy or by global health research, we may not. But we know of the stories. We know of the stories of the people. And that's where compassion and love is so essential. Because what compassion asks us to do is to put into practice our very call to serve. I don't think there is a single person in global health or in health in general who doesn't at some level get motivated by the need to help another, by the need to serve someone else or other group of people, by the need to make a difference, either locally or globally. And that call to serve is expressed in an action, and that action is compassion. Practitioners are frustrated by the limitations. They're frustrated by the limitations of time. They're frustrated by the limitations of resources. And they're frustrated sometimes by the limitation of bureaucracies that don't necessarily understand what really is important on the day-to-day level. I think most people in global health are driven to bring equality to people in terms of having their suffering addressed, having their needs met, medical, physical, emotional, spiritual. Where they're frustrated is that to go from recognizing that one needs to meet those needs to implementing changes is very hard. There is in fact data from a variety of different sources that show that compassion makes a difference. It makes a difference in the lives of patients, and it makes a difference in the lives of the people that provide that care. I'm frequently asked by physicians, by others, do I really have time to practice compassion? Do I have time to take a spiritual history? No, I have 20 minutes, I have a half an hour, I have 10 minutes. No, I don't possibly have time. Compassion is not time dependent. It's not time dependent. It can happen in that moment. And that moment, that second, can have a profound impact on another person's life. People may feel very alienated by their system. They may be feeling alienated by their family on an individual level. They may be feeling because of their illness or where they are in their economic life that they don't belong. And that moment, by a healthcare professional showing that person compassion, showing that person love, they may see a value in themselves that they've never seen before. My passion is about making sure that all of our healthcare systems, no matter where they are, have compassion as their foundation, as the foundation for everything they do, for the care that they provide, for the policies that they create, and for the people that they choose to work with them. And that's what I think compassion is about.